We talk a lot about the usual vital signs, like breathing and pulse, but what about what's happening deeper inside, deeper in your circulatory system? It's this hidden network of pressures and flows.
Right.
And one of the key things we can measure to understand that system is central venous pressure.
Yeah, CVP.
Or CVP. So today we're going to deep dive into CVP.
Okay.
Exploring what it tells us about the body's balance, how it's used in medicine.
Sounds good.
So buckle up.
Right.
We're going to navigate the highways and byways of your circulatory system.
Love it.
And uncover the secrets of CVP.
All right. So what's really interesting about central venous pressure is it's like this pressure gauge for the right side of your heart.
Okay.
Specifically, the pressure in the superior vena cava, the large vein bringing blood back from the body.
Okay.
So think of it like checking the traffic report on a major highway leading into a bustling city.
Oh, okay. I like that traffic analogy.
Okay.
So if CVP is high, does that mean there's a traffic jam in the vena cava?
Yeah.
Is that automatically a problem for the heart?
Well, it's not always that straightforward.
Okay.
While an elevated CVP can definitely signal a problem,
Right.
it's crucial to kind of consider the bigger picture.
Okay.
Your body's constantly working to maintain this delicate balance in your circulatory system.
What do you mean by balance?
So imagine a seesaw.
Okay.
On one side, you've got the volume of blood returning to the heart.
Uh-huh.
And on the other side, you have the heart's ability to pump that blood back out.
Good.
CVP is one indicator of that balance.
Oh, so it's not just about the pressure itself,
Right.
but what that pressure is telling us about how well the entire system is working.
Exactly. CVP can give us clues about blood volume, heart function, and even lung health.
Okay.
It's like a puzzle piece that helps doctors understand the overall picture.
Right, right. Now, we have a bunch of reasons why doctors monitor CVP.
Yeah.
And it seems like it's used for a lot more than just emergencies.
Absolutely. CVP monitoring is a really versatile tool.
Okay.
It can be used in a bunch of different situations.
Okay.
For example, it's crucial for making sure medications are delivered safely and effectively.
Okay.
You see, certain medications, like potassium chloride, can be quite harsh on peripheral veins.
Why is that?
Well, if you inject potassium chloride directly into a smaller vein, it can irritate the lining and cause inflammation,
Oh, okay.
something called phlebitis. That's where a central venous catheter comes in.
Ah, I see. So that's where the central venous and CVP comes in.
Precisely.
Okay.
By accessing a large central vein, doctors can deliver medications into a larger volume of blood.
Okay.
This dilutes them and reduces the risk of irritation.
That makes a lot of sense. It's like choosing the right size pipe for the job, right?
Yeah.
To ensure a smooth flow. So how do they actually get that catheter into a central vein? Is it just like a regular IV?
It's not exactly like a regular IV. It involves placing a thin, flexible tube called a catheter into a large vein, often the subclavian, the internal jugular, or the femoral vein.
So they're going right into those major vessels.
Yeah.
That sounds a bit intimidating.
It is a delicate procedure,
Yeah.
requires specialized training and techniques,
Okay.
and there's a reason why the right internal jugular vein is often the preferred site.
Oh, why is that?
Well, the right internal jugular vein offers a more direct and straightforward path to the superior vena cava,
Okay.
where the catheter needs to be to accurately measure CVP.
Gotcha.
So imagine like a tiny thread carefully navigating a delicate maze guided by skilled hands
Right.
until it reaches its destination.
Okay.
Yeah.
Okay, I can picture that. And our notes do mention a few peripheral vein options, but those are less common, right?
There are less common. The key is to position the tip of the catheter in the superior vena cava,
Right.
so you get an accurate pressure reading.
Right. So we've got this tiny sensor right in the heart of the action, sending back all this info about the blood flow. So we have the number, but what does it mean? When do those numbers start flashing red for the medical team?
Okay, well, that's where the detective work begins.
Okay.
A normal CVP typically falls between 2 to 6 millimeters of mercury or 4 to 12 centimeters of water.
Okay.
But as we discussed, it's not just about the number itself.
Right.
It's about what it tells us about the patient's condition.
So if the CVP is outside of that range, that's when they start to dig a little deeper.
Exactly.
Okay.
If we see an elevated CVP, it could indicate a few things.
Okay.
Remember how we talked about CVP reflecting right ventricular function?
Right. The right side of the heart pumping blood to the lungs.
Precisely.
Uh.
Now, if that pressure is high,
Uh-huh.
It could mean that the right ventricle is having trouble keeping up with the incoming blood flow.
So it's like that traffic jam we were talking about.
Yeah.
The heart isn't clearing the way quickly enough.
That's a great way to visualize it. And this can happen for various reasons, right?
Mm-hmm.
Maybe the right ventricle itself is weakened, a condition known as right ventricular failure.
Oh, wow.
Or perhaps there's something obstructing the flow of blood, like a narrowing of the pulmonary valve leading to the lungs.
Oh, okay. So the heart itself could be the problem.
Right.
Or it could be something further down the line.
Exactly.
Okay.
And it's not just the heart we have to consider, right?
Yeah.
Remember that delicate balance we talked about?
Yeah.
If the CVP is high, it could also mean that too much fluid is returning to the heart.
Okay.
A condition called hypervolemia.
So too much fluid, too much pressure.
Yeah, think of it like too many cars entering the city at once.
Right.
Overwhelming the system.
Okay.
And just like a traffic jam can ripple outwards, affecting surrounding roads, the effects of an elevated CVP can be felt throughout the body.
This is where it gets really interesting. So how does the body try to compensate when CVP is high?
Yeah.
Does it just accept defeat?
Not at all. The body is incredibly resilient, always driving for balance.
Okay.
One of the ways it compensates for increased CVP is by increasing heart rate.
So it's like the heart's trying to pump faster to clear the backlog.
Exactly.
Okay.
It's like adding an extra lane to the highway.
Right.
However, if the underlying problem persists, this compensatory mechanism can only do so much.
Right. So the body's trying to fight back, but it's not a sustainable solution.
Right.
What about the flip side? What causes CVP to drop below that normal range?
So a low CVP often indicates a decrease in the volume of blood returning to the heart,
Okay.
a condition known as hypovolemia. Imagine those highways leading into the city suddenly having very few cars.
So not enough blood going back to the heart.
Exactly.
What causes that?
Well, it could be due to a number of factors. Maybe there's been significant blood loss,
Okay.
like in the case of a hemorrhage.
Right.
Or maybe the blood vessels are dilated, allowing blood to pool in the extremities and reducing the amount returning to the heart.
So it's like the blood is taking a detour, getting diverted away from the main route.
Exactly.
Got
And
it.
just like a city might struggle to function with reduced traffic flow,
Yeah.
the body can't operate efficiently without enough blood returning to the heart.
Right, right.
This can lead to a drop in blood pressure and decrease the amount of oxygen delivered to vital organs.
It sounds like a delicate balancing act.
It is.
Too much or too little blood can throw off the whole system.
You're absolutely right. And that's why understanding CVP is so crucial.
Yeah.
It gives us a window into this complex interplay of pressures and volumes within our circulatory system.
Right.
Allows doctors to assess the situation and intervene appropriately.
This has been so insightful. We've gone from a very basic understanding of CVP to a much deeper appreciation for its role in maintaining that balance in the system.
Absolutely.
But we've only scratched the surface.
We have.
Our notes delve into some of the challenges of interpreting CVP readings.
Wow.
It's not always as straightforward as we might think.
You're right, and that's what makes it so interesting.
Yeah.
Stay with us as we explore those factors that complicate CVP readings
Okay.
and how doctors navigate those challenges.
This is where the real detective work begins.
Absolutely.
We'll be back in a moment to unravel more of the mysteries of CVP.
Sounds good.
Welcome back. We're right in the middle of our deep dive into central venous pressure. And we've uncovered some interesting insights into how CVP reflects this dance between pressures and volumes within the circulatory system.
It is a delicate dance.
Yeah, but as we hinted at before, interpreting CVP, it's not always so black and white.
Right.
There's certain factors that can throw off those readings, make them more complicated.
Yeah, it's definitely more nuanced than just high CVP equals this and low CVP equals that.
Right.
You have to look at the whole patient, their individual circumstances, all the factors that might be skewing the reading.
Okay, so what are some of those factors that can really throw off those readings?
Well, one factor that comes to mind is the patient's own physiology.
Okay.
For example, if their veins are constricted throughout the body, this is called systemic venoconstriction.
Okay.
This can artificially elevate the CVP reading, even if their blood volume is totally normal.
Oh, so it's like the body is creating its own traffic jam, completely separate from what's going on with the heart.
Yeah, it's a good way to put it. Imagine squeezing a garden hose.
Okay.
the pressure inside goes up.
Yeah.
Even though the amount of water flowing through it hasn't changed at all.
So a doctor might see a high CVP and think, oh, there's an issue with the heart or there's fluid overload, but really it's this venoconstriction throwing things off.
Exactly. And that's why it's important to consider all the pieces of the puzzle. You can't just look at CVP in isolation.
Right. Okay, so the body itself can make things more complicated. But what about external factors? Can anything outside the body influence CVP?
Oh, for sure. Remember when we talked about mechanical ventilation earlier?
Right, the breathing machine.
Specifically the use of PEEP, positive end expiratory pressure.
Right, right. You mentioned that could affect CVP, and this is where I get a little lost.
Okay.
Because if PEEP increases pressure in the chest, wouldn't that make it harder for blood to return to the heart? Shouldn't that lower CVP?
You know, that's a really good question. It kind of highlights how counterintuitive this can be.
Okay.
So while PEEP does increase pressure in the chest, which can hinder venous return, it also increases pressure within the heart itself.
Oh, okay.
Leading to that elevated CVP reading.
Oh, so it's a bit of a tug of war.
Precisely. The net effect on CVP can vary depending on the amount of PEEP used and how the patient responds.
Okay.
It just goes to show that interpreting CVP really requires understanding the entire context.
Right. Okay, so we've got internal factors like venoconstriction, external factors like PEEP that can complicate things.
Yeah.
Anything else we need to keep in mind?
Well, we can't forget about the potential complications associated with the central venous catheter itself.
Right, right. We can't just skip over that. So what are some of the risks that are involved?
Well, like any medical procedure where you're inserting something into the body, there are going to be risks involved.
Yeah.
One of the most serious ones is an air embolism.
An air embolism?
Yeah.
That sounds pretty scary. What exactly is that?
Okay, so picture this. You have a water pipe, and suddenly a big air bubble blocks it.
Okay.
The water can't flow freely anymore, right? Now think of your bloodstream as that pipe, and the air bubble as an air embolism.
Okay, so an air bubble gets trapped in the vein, blocks blood flow.
Exactly. And if that air bubble reaches the heart or the lungs, it can cause serious damage, even lead to cardiac arrest in really bad cases.
Wow, that's intense. How do they prevent that from happening during the catheter insertion?
Well, thankfully, there are a number of precautions in place.
Okay, good.
To minimize that risk. For instance, the patient might be asked to do something called the Valsalva maneuver.
Okay.
Which involves bearing down as if they're having a bowel movement.
Okay. And what's the purpose of that?
So this, along with positioning the patient with their head lower than their feet, a position called Trendelenburg, increases pressure in the veins, making it much harder for air to get in.
Okay, so using gravity to their advantage.
Exactly.
And the Valsalva maneuver.
That temporarily increases pressure in the chest, which helps to prevent air from being sucked into the veins during insertion.
So they're taking every precaution to make this as safe as possible.
Absolutely. And if an air embolism is suspected, the medical team will act quickly. They'll position the patient on their left side and try to aspirate or suck out the air from the catheter.
So they're trying to remove the blockage as quickly as possible.
Exactly. Time is of the essence.
Yeah.
Now, in addition to air embolisms, there are other potential complications, like bleeding at the insertion site, infection, and blood clots.
Right. Bleeding, infection, clots, those are all pretty serious, but I'm guessing they're relatively rare.
Thankfully, yes. With the right techniques, sterile procedures, and careful monitoring, these complications don't happen often.
Okay.
But it's important to be aware of them and to be ready to act fast if they do come up.
Right. Minimizing risk and being prepared. Okay, so we've talked about what CVP is, how it's measured, and even some of the complexities and complications.
Right.
Now I really want to dig into what makes those numbers actually change.
Yeah.
What makes that pressure go up? What makes it go down?
That's the heart of the matter.
Yeah.
This is where our understanding of the circulatory system really shines. Let's start with the things that can increase CVP.
Okay, so what sends that pressure soaring?
Well, as we talked about before, right ventricular failure. It's a big one.
Right.
When the right side of the heart isn't pumping well, blood backs up in the vena cava, and that causes the pressure to rise.
Right, like that traffic jam. The cars aren't moving through the city, and there's congestion on the highways leading in.
Exactly. And just like traffic jams have different causes, there are a lot of things that contribute to right ventricular failure.
Like what?
Well, it could be a problem with the heart muscle itself, like damage from a heart attack.
Okay.
Or there could be an obstruction to blood flow, like a pulmonary embolism, which is a blood clot blocking the artery to the lungs.
So the heart itself might be the issue, or there might be a blockage down the line.
Yeah, it's a bit of a mystery sometimes.
Okay. What else can cause CVP to go up?
Another major factor is fluid overload or hypervolemia.
Right, remember the seesaw?
Exactly.
The balance between blood returning to the heart and the heart pumping it out.
If there's too much fluid in the system, it tips that balance and makes CVP go up.
So too much fluid equals too much pressure. What causes that fluid buildup to begin with?
It could be a number of things. Sometimes the kidneys aren't working as they should.
Okay.
And they aren't removing excess fluid from the body.
Okay.
Or maybe the patient's getting too much IV fluid.
So it could be a problem with the body's filtering system or something external like the IV fluids.
You got it. And certain medical conditions can also lead to fluid overload, things like heart failure and liver disease.
Wow, so many things can contribute to high CVP. What about low CVP? What makes the pressure drop?
Well, as you might imagine, many of the causes of low CVP are basically the opposite of what increases it.
Okay, so if high CVP often means too much fluid or a struggling right ventricle, low CVP means not enough fluid or weak pumping action.
You're on the right track.
Mm-hmm.
Hypovolemia or low blood volume is a very common cause of low CVP.
And that's usually caused by things like blood loss or dehydration, right?
Exactly. Not enough blood returning to the heart means the pressure in the vena cava goes down.
It's like those highways leading into the city suddenly being empty. Not enough cars to create traffic.
I like that. And just like a city can struggle when there's not enough traffic, the body can't function right without enough blood volume.
Right, because we need that blood to deliver oxygen and all the good stuff to the organs. So, besides volume depletion, what else can cause low CVP?
Well, some medications can cause vasodilation,
right,
which is a widening of the blood vessels.
And that would lower CVP because there's more space for the blood, which reduces pressure, right?
Exactly. It's like widening the highways. Now the same number of cars can travel more freely. No more congestion.
This is really making sense. So we've got the factors that make CVP go up, like fluid overload and right ventricular failure, and those that pull it down, like hypovolemia and vasodilation.
Right.
And it's that understanding of what's causing the changes that allows doctors to interpret the CVP reading correctly and make good decisions about how to treat the patient.
Could have said it better myself.
Okay, great. So CVP, it's not just a number, it's a clue.
Exactly.
A little piece of the puzzle that helps us understand this very complex circulatory system.
It's a fascinating system.
Welcome back to our deep dive into CVP.
It's been quite a journey.
It has been.
Yeah.
We've explored what it is,
right,
how it's measured,
all the factors that can make those readings go up or down. But now I'm wondering, how does understanding CVP actually play out in real-life medical care?
Right.
How do doctors use this to make decisions and to actually treat people?
So CVP isn't just some number on a screen.
Right.
It's a tool that can inform all sorts of medical interventions.
Okay.
Take surgery, for example.
Okay, so how does CVP work in the operating room?
Well, imagine a patient undergoing major surgery.
Okay.
There's always a risk of blood loss, right?
Right.
Monitoring CVP can help the surgical team figure out the patient's fluid status throughout the surgery.
Okay, so if the CVP is dropping, that could mean that the patient needs more fluids.
Exactly. And the opposite is true too.
Okay.
If CVP is rising too quickly, it could signal fluid overload.
Right.
And they need to adjust how much fluid they're giving.
So it's this constant feedback loop.
Yeah.
Helping the team keep things balanced.
Precisely.
Yeah.
CVP is also incredibly useful in critical care settings.
Especially for patients on ventilators or dealing with heart problems.
Yeah. I can see how it would be important there. Things can change so fast.
Absolutely.
Can you give me an example?
Sure. Say you have a patient in the ICU with heart failure.
Okay.
Monitoring their CVP can help the team determine how well the heart's pumping.
Okay.
And if the medications they're giving are actually working.
So if the meds are doing their job, they'll see the CVP going in the right direction.
Exactly.
Okay.
And if CVP stays high even with treatment, it might mean they need to do something more aggressive, like change the medications, or maybe use a device to help the heart pump.
So it's like CVP's a compass, guiding the team to figure out the best way to treat the patient.
I like that analogy.
Yeah.
And it's not just about reacting to problems as they come up.
Okay.
CVP can also play a role in preventing issues before they even start.
Oh, how so?
Well, for patients with chronic conditions, things like heart failure or kidney disease, monitoring CVP can help doctors spot early signs of fluid buildup or problems with the heart's function.
So they can step in and help before it turns into a major issue.
Exactly, staying ahead of the game.
Keeping that balance in check. This has been really eye-opening. I had no idea how much you could learn from this one single measurement.
It's amazing what you can learn from it.
Yeah.
It really is a fascinating look into how the body works.
Right.
And its importance in medicine just keeps growing.
Speaking of growing, what about new developments? New advancements in CVP? Where is this field headed?
Oh, that's a great question. One really exciting area is less invasive ways to measure CVP.
Oh, so moving away from the traditional catheter.
Exactly. Researchers are looking at new technologies that can estimate CVP using ultrasound.
Okay.
Or even wearable sensors.
Wow, that's pretty amazing.
Yeah.
Would definitely make monitoring CVP a lot easier and more comfortable for patients.
Absolutely. And it could open up the use of CVP monitoring beyond hospitals, maybe allowing for earlier detection and management of problems.
Bringing the power of CVP into everyday life, that's a game changer.
It really could be. And as we understand more about how our circulation works, I think we'll see even more cool ways to use CVP in the future.
Wow. Well, it sounds like the future of CVP is pretty bright.
It is.
This deep dive has been amazing.
It has.
We've gone from a basic understanding of what CVP is to a much deeper appreciation for all its complexities and its significance in medicine.
It's been a pleasure exploring this with you.
Likewise. And to our listeners, thanks for joining us on this journey through the veins of knowledge. We hope you've gained a new appreciation for your own circulation and the critical role CVP plays. Until next time, keep those blood vessels pumping and those brains curious. We'll catch you on our next deep dive into the world of knowledge.